So without further ado, I'd like to introduce our first speaker for this session, Ms. McKenzie AM. Anne is head of the West Australian Consumer and Community Health Research Network. Her key task is to implement a statewide consumer and community involvement program across the West Australian Health Translation Network's 18 partner organisations. In January 2015, Anne was appointed to the Order of Australia for her 20 years of service in the area of healthcare consumer advocacy, and we really look forward to hearing her unique perspective amongst this group today. Thank you, Anne.
Thanks very much for having me here today. What I'd like to start with is to make sure we're all on the same page and just give you a definition that we use for consumer and community involvement, and this is very much aligned with the National Health and Medical Research Council's definition as well. So consumer and community involvement is about researchers, consumers and community members working in partnership to make decisions about research priorities, policy and practice. It's about research being conducted with people rather than to or for them. So it's about getting the whole picture, one that's inclusive of the consumer voice. And I think that you cannot talk about the effects of the value and the impact and the cost if you're not including the consumer voice actively in your research. So what it's not about, and what I'm not going to be talking about, is the participants, the subjects, or in research, or the recruitment to trials. It's hopefully not an opportunity for you to tick that box, and it's not about public relations and fundraising. So to get started, I think it's really appropriate that I do a very small research project right here now. It's not going to take you much to be involved in this research project, except you need to be honest. So I'd like you all, if you conduct clinical trials, to put your hand up, please. Okay, so that's a lot of you in the room. So keep your hand up. Keep your hand up, all of you put your hand up before. Keep your hand up if you have consumer involvement in the management of your trial. So keep those hands up. Wow, we really lost quite a lot of people then. So keep your hand up if you have consumers involved in all levels and stages of the trial, and that's about the design phase, steering committee or a community reference group. So could you really raise your hands? So we've got very few left. Okay. And so lastly, keep your hand up if you have evaluated the impact of the involvement activities on the trial. Well, we've actually got quite a way to go because I can't see any hands up. So, oh, you at the back, fantastic. Give the person a round of applause. Okay, so I think you can see in Australia, not only do we not know, I was a bit blown away, Steve, we don't know how many people are in trials. Now we're saying that you're not actually actively involving consumers in the trials, but you want to talk about value and impact of costs. So let me help you. Consumer value for research is from a consumer perspective. It has three key phases: the development of the hypothesis, the methodology, and of course seeking the funding, the conduct of the research and the reports, and then communicating and implementing the results. Maximum value for consumers is where each phase is managed efficiently and the results ultimately lead to improved health outcomes. It's all about the impact of the investment of time and money and the translation of research results into policy and practice, particularly when you're using public funds. There's national support for consumer and community involvement in trials and in research. We have national and state consumer organisations. We have them in every state, and we have a national peak body, Consumers Health Forum. The National Health and Medical Research Council has a Consumer and Community Advisory Committee, and they have a clinical trials section, which I believe they have really good involvement from very senior consumer reps, making a difference to the work that they're doing. And very shortly, the National Health and Medical Research Council will be releasing their revised statement on consumer and community involvement. We've got the Medical Research Futures Fund commitment to having a consumer-driven research agenda. We've got involvement programs. I think Cancer Australia is an outstanding example of where they would like consumer involvement to be at all levels of the work that they're doing. And it wouldn't be opportune for Western Australia to come to the East Coast and do a little bit of bragging about the program that we do in the West, because of course everything's wonderful in the West. The Consumer and Community Health Research Network, which I head up, is a statewide program that provides all of the things that are listed there. We have a website called Involving People in Research. There's a lot of resources, publications, etc. that I would encourage you to go and have a look at. Not a lot of work there about clinical trials, but there's, watch this space. We also have a network of consumers from across the state and across Australia where we can sort of advertise vacancies for people to be involved in research, and people can apply back through our processes and systems. So I'd encourage you to have a look at our website, and please feel free to contact me. We've got some fantastic good practice initiatives happening around this country. As I said, in the Cancer Clinical Trials Group, I found out that we have consumers on safety and data monitoring committees. There is a consumer chair of the Breast Cancer Network and consumer advisory panels for all trial groups. There's the consumers involved in developing protocols in lung trial groups. And so, they're a really, really good example. And on their website, they've got training, they've got resources and all sorts of things to support you and help you to get started. At the Telethon Kids Institute in Perth, they are collaborating with the McKenzie in the Northern Territory, and they're running a rotavirus vaccine trial, and they've had Aboriginal community involvement in all stages, from the concept stage right through funding and then implementation, where they've got community groups actively out recruiting for people to take part in the trial. The Miracle Babies Foundation, I know in the past, I'm not sure exactly what they're doing now, but I'm sure they're continuing to do the good things. And in the past, they've used things like Facebook and Twitter to actually help recruit their members to trials, and with lots and lots of success. And Canteen, I've recently been told they're intending to do some trials next year, some interventional trials, and they, of course, will be having really good consumer involvement right the way through. So that's a bit of a watch this space area. So I think I'd really like to talk about what Steve mentioned. Internationally in the UK, the National Institute for Health Research, they've got fantastic resources from a support unit that they fund, Involve, and there are some really, really good publications around there, particularly on briefing notes for researchers involved in clinical trials. They have the research design services, and until 2010, I was the only person in Australia working in a university in a role like this, a consumer advocate in health research. And in England alone, they have over 240 patient and public involvement leads. So it just goes to show the commitment that's there. The Medical Research Council has a patient involvement group for their clinical trials, and again, they have some really good resources that you might like to take a bit of time and have a look at. What I have heard from my colleagues in the UK, that the National Institute of Health Research really put money into increasing involvement in trials. And they do have something like about over 600,000 people involved in trials. And one of the things that I was told, that 89% of British people are willing to take part in research. They did a survey a couple of years ago, so that's huge. And 97% of people said they'd be willing to take part in a clinical trial. So they have really attributed the success of the recruitment that they have in clinical trials to patient and public involvement. And Dame Sally Davis, who was the recently departed head of That sounded a bit like she died, didn't it? But she's well and truly alive. And she, when I was in London in May, listening to her speak at NIHR 10, she attributed to the success of recruitment in clinical trials to the patient and public involvement investment that they've made in research across the NIHR. So I think that that's something that we could aspire to. So there's some really fantastic examples of consumer and community involvement in trials and more broadly in research, both in Australia, in Western Australia, and of course in the UK and other countries as well. And yet in Australia, consumers still see inefficiencies because their priorities for research aren't always considered, and it's hard for them to define the value or cost benefits of a particular piece of research or trial. And particularly, they haven't been consulted or informed about outcome measures that are important for the trial and important to consumers. Funding efforts are focused on NH and MRC, which may limit opportunities for innovative models and different partnerships. Trials have less than optimal recruitment numbers, and results are communicated mainly through peer-reviewed journals and conference presentations, which can be influenced by publication bias and not reporting on negative findings. So I think it's very difficult. This was quite an interesting exercise for me. I tried to find out what sort of consumer involvement was happening in clinical trials, and I just found it almost impossible to find out. But I'm heartened by the fact that you don't know how many people are actually in trials, and not many of you are involving consumers in what you do. I think it's time to make a shift. I think we've passed the point where consumers are happy for people to speak to them or for them or about them. People want to be involved, as I said, public money, public benefit, and the value needs to be taken into account. I think consumers can add value by being involved in developing research hypotheses, having input into protocols to suit the needs of consumer groups, to make sure that they're willing to take part in the trial, both as, involvement as a team member, but also to use their networks to recruit members to it. They, of course, can develop patient documents, and they can use their networks, as I said, to increase trial participation. They can also provide a consumer perspective on results and finding, assist with communication, and mainly support and advocate for translation into policy and practice. And then, of course, there's always the new research that's lurking around the corner. So what's needed to support it? And I firmly believe we need a national centre, whether it's built within an existing model of Consumers Health Forum or something like that, but we need to actually be able to provide training for researchers and consumers. We in Western Australia actually have training workshops for researchers, and I have facilitated over 70 of those training workshops that are run for researchers about implementing consumer and community involvement. We also run training workshops for consumers to make sure that when they are sitting on your team, they're actually as effective as they can be. We think there needs to be national resources and toolkits available, but of course you need to use them, and there needs to be support for researchers to implement involvement initiatives. The other thing that I think is lacking, you can do fantastic, like the gentleman down the back, consumer and community involvement, and unfortunately the system doesn't always recognise or reward what you do, and I think that that's something that needs to be addressed. As I said, you can do fantastic research with no consumer involvement, or you can do fantastic research with consumer involvement all the way through it, and you'll both end up with exactly the same rewards, other than people like me saying you're doing a great job. I think we need for associations like ACTA and other associations calling for consumer involvement to be standard practice in all research. NIHR have done it, and they tell me now they would rarely get a grant application that doesn't have planned, budgeted consumer involvement in all aspects of it. And I think we need to have researchers and consumers working together to add value to health research, so that when we talk about cost benefits, we're actually making sure that that's taken into account. So 5 years down the track, what I'd like to see is no more buzzwords about patient-centred care when people are actually talking on my behalf about what I might need as a patient. So I think that's something that I'd like to see. But more importantly, I'd really like to see in 5 years down the track, when I'm sitting on the veranda of the Senior Citizens Club, that we have public posted at all levels of research. And I think that that will be something that we can all be proud we've actually moved from being a room like this, where one person is evaluating the impact of good consumer and community involvement, to where the majority of the room are doing it. So thank you very much.